Hi everyone, Grant and Jasmine here from Method Dental. You might wonder why we're at the Kedron Brook today. Well, we're having a talk about Bruxism,
Yep.
which is clenching and grinding your teeth, sometimes during the day, sometimes during the night. But today's more of a personal story,
Yep.
isn't it? It's about Jasmine and her personal story with Bruxism. Yep. You'll find out why exactly we're at the brook later on, but for now, it's back to the surgery.
Yep.
So what do you think? We'll start from the start?
Yep. So basically I started experiencing symptoms 2 years ago. I'd wake up with really sore jaw muscles. I'd get headaches in my temple area. I couldn't eat breakfast in the morning. I couldn't open my mouth. So that was, really uncomfortable.
Yeah, I'll bet. And what did we do initially for
Well, initially Grant taught me to sort of massage the area, the jaw area, use a heat pack, and also take some non-steroidal anti-inflammatories like Nurofen.
Some light exercises can be useful too. So like stretching exercises for your jaws. How did that go with the pain?
It helped at the stage, but I think I was going through a really stressful and anxious time. And so my clenching actually got worse, and so the pain escalated.
Yep.
And it just got out of hand.
Yep. What was the final result? Like, what happened to your teeth because of this clenching?
Well, it resulted in a cracked tooth. And that was really shocking to me because I didn't think something so, benign could cause something so drastic.
Yep. And in Jasmine's particular case, this cracked tooth, it was really difficult to diagnose. Cracked teeth often can be one of the hardest things for dentists to diagnose. In her case, it was a really fine crack, basically not visible to the naked eye. We had to get a special light to diagnose it. We tried to treat it with a filling. The filling didn't work, and that's often the case with cracked teeth, so we upgraded her to a crown. That was about a bit over a year ago. How'd the crown go?
Yeah, crown worked perfect. It stopped the pain in my tooth so I could actually chew again. But that didn't obviously, solve the problem of the clenching.
Yep.
So we decided that I had to wear a splint when I go to sleep.
Yeah, and so a splint is like a mouth guard.
Yeah.
Not like a sporting one, it's a bit thicker and harder, and people wear it to sleep at night if they're clenching or grinding their teeth together. So how did that go?
Yeah, it worked really well. I no longer get, the pain anymore. I don't wake up with
pain like in your muscles?
Yeah, so I don't get jaw pain anymore. I don't get headaches in my temples.
Yeah. Awesome.
It's worked really well.
So with the splints, we know that it can work quite well for the muscular type pains and the headaches. Success rate around 90% or above, but it's not a guarantee because we don't understand all of the mechanisms with clenching and grinding and the pain. But that's really good to hear that it worked well.
Yeah, and the splint, I guess, was more so as well to stop me getting another cracked tooth because we didn't want that to happen again.
Because it acts like a helmet for your teeth, so it helps to protect against more cracks.
Yeah.
How is the splint? Is it comfortable?
Not at the start. So it took a while to get used to. You can't speak very well. You'll drool a lot at the start, but like anything, you adapt, and best thing ever.
Yeah, that's what we tell all of our patients is that the splint, while it might not be the most flattering thing or the most comfortable at the start, you persevere for maybe a few weeks, sometimes a couple of months, and then it really does what we say it does in terms of protecting the teeth, and in most cases helps with those pains as well.
Yeah, absolutely.
All right, so with the symptoms that you experience, Jasmine, the pain in your jaws and your temples, those aren't the only things that you should be looking out for. So you can get pain actually in your jaw joints, and sometimes it can feel like earache, but it's not. You can get cracked teeth like you did, but also broken teeth and broken fillings. You can even wear down your enamel over time, and those are all things that your dentist can help you diagnose.
Yeah.
So treatment options, we touched on the initial therapy for the milder cases, massage, exercises, stretching, non-steroidal anti-inflammatories if they're safe for you to take, and heat packs. If the pain persists, definitely need to have it assessed by your dentist.
Mm-hmm.
In some cases, we'll refer you onwards to a physiotherapist for physical therapy.
Yeah.
A splint may be necessary in some cases, like Jasmine's, where we don't want to get any more cracked teeth.
Yeah.
It was also very effective for the pain.
Yeah.
And in some rarer cases where all of those things haven't worked, we may need to refer you onwards to a maxillofacial surgeon, or a dentist that's more specialised in these kinds of pains.
Sure.
Sometimes even chronic pain management specialists as well.
Sure. So now that we know more about bruxism, let's go back to the start. Why are we at the brook?
Well, it's because we mentioned stress and anxiety as a risk factor for bruxism earlier. So what we can recommend to some of our patients is to try and reduce that stress. What better way to do that with a walk at the brook?
100%. There's the water, you
Dogs.
can bring your dogs. We're just really lucky that we're really close to the brook, so we get to come here all the time.
Yep. So go for a walk, reduce your stress and anxiety levels, and we'll see you next time on the next video.